I am Dr. Joseph Caruso. I'm a prosthodontist in Chicago, Illinois, and also I'm the prosthodontist at Stroger Center of Cook County in Chicago. Hannah is a patient of mine for the last 4 or 5 years. The patient had an unfortunate accident many years ago and lost all of her teeth, maxillary mandibular teeth. As a result of the traumatic injury, she had atrophy of the maxillary arch and the mandibular arch. Preliminary x-rays did not reveal sufficient quality and quantity of bone for any implants at the beginning of treatment. As a result, after proper CT scans, we decided to use autogenous bone. Autogenous bone is from the patient themselves. And so in Hannah's case, we prepared her for surgery. Took grafts bilateral from the hips. What I'm doing is turning on the Ostel unit, okay? What I'm doing is an example. I'm going to ask you, Dave, if you see this up on the screen, this area. This is a sample here, analogous to a peg that we're going to put into the implant, okay? So here's the implant, and here is the peg that I'm going to screw in, and I'm going to hand tighten it, okay? Resembling an implant. So I'm going to place this probe right next to here, and it's doing this electromagnetic, and what does it say, 70? Right? Could you see that? On the screen? Okay, you can't see it. Can you see that? Okay, is it read 70?
You can't see it.
They can't?
Yeah,
maybe if you just...
In other words, what you want to do is maybe I could hold it this
Yes.
way?
Perfect.
Okay, so the probe is here, okay, this little peg, right? And so what I'm going to put this is the implant, and it read 70. Now, let's say that the implant was loose, okay? Or wasn't fully integrated. So I'm going to loosen this peg in that area, okay? And we have a loose peg implant. What does it read? 28, okay? You see this?
Yeah.
Okay, so that's indicative of the stability of the implant in primary stability or so. So that if I tighten it just a little bit more for illustrative purposes with it.
Dr. Caruso.
17, okay? So you could see the point that I want to make is that depending on the stability of the implant, whether it be initial stability or after integration, we could get different readings. And this gives me an idea of when to restore. Now what I'm going to do in Hannah, for simplicity, because I'm not going to do this throughout the whole 10 units, okay? Because I think the protocol, the procedure is going to be the same. You're going to see this. So I took one of the healing capsules off in the bicuspid, chin a little higher now. And what I'm going to do here is to place the magnetic peg in, hand tighten it. All right, good. And then what I'm doing is here putting it right over close to the buccal lingual. And I get a reading of 69. You don't have to see that, but it's 69, okay? Then I'm going to go, as I mentioned, mesial distal because the bone is a little thicker there. And I get 68, okay? So we got a good integration of the implant, okay? And then start taking the healing abutments off. Oh, do you want a little bit of Novocaine on that back one? Let's go ahead and take off the abutment. Later I will show you, but I'm not going to take this off here. She has 5 implants on the lowers, 4 implants on the lowers, with a CAD-CAM bar with 3 locator attachments with Veneris teeth on the lowers. Excuse you just to take a look and see if you could see this, okay? Just one in the audience tell me, could you see the implants?
Yes.
All right, and they may not be as clear as I see them here, but the tissue response is very nice, maintaining nice oral hygiene. Now, what I want to do is to show you when you're doing multiple implants, and you're getting engaging custom abutments, with a system that has the internal hex system, you need some verification jigs. And ought to give me one of these here. These are the verification jig. And Luke, could you just describe them? You have them numbered, is that for me?
Yeah, we made verification jig from GC pattern, the wax. We made two split together. Then I put down the number, which is back side, the tooth number. So Dr. Caruso, after put it into a bottom in the mouth, then he can double check it's the right fit.
And it's important to do this because you're going to see a little bit of, I don't think of a problem, but if you don't have this jig, then literally the orientation of these abutments maybe a little, hold this up here, Ada.
And also our implant abutment facially, we make a straight line for facial area. And the back side, we try and put the number in case you lose it.
Would you help me doing this? Your chin a little. How is that we hold this in here? And Aida Lou, do you hold this for me? While where are we?
Joe, can you talk a little louder?
Oh yeah.
Okay.
What I'm doing is orient this jig in the mouth. And, okay. If I get one of the screws set, then we're fine. Okay, so you're gonna have